So slightly different clinical skill now. Collection of venous and capillary blood samples. We're not doing the venous part. We're not doing the venipuncture bit yet. I think we've got that one in a week or so's time, or if we've not already done something around venipuncture, I can't remember. But anyway, we're looking at the capillary blood sample bit. And that's because it ties in with vital signs. And that's because obviously one of the things that we need to get from time to time is blood glucose for people. And equally, there are some other tests in which you can do, such as cholesterol tests, vitamin deficiency tests, etc., that require capillary blood samples. So the normal method for a capillary blood sample is obviously the good old finger prick using a lance, and then either some suction device, or you can put the droplets of blood on to the stick, depending on what you're doing. The suction cups are more designed for when you need to get a fair amount of blood, and you normally get little test tubes to put the blood sample in, if that's the way you're going to do it. But the reality is finger pricking or capillary testing is relatively safe. Now, if you can't get it from the hands, where else do you think you can get it from?
From here.
So, okay, so we're going to go to the top. Anywhere else? Any other suggestions?
Toes.
Toes. So we can do heels, especially for young people or infants. So either side, you can get a capillary sample there if you needed to. I've never, ever in my career had to do it. I have seen it done. I've never had to do it because normally for us adults, they normally give you hands. So it's not normally a problem at all. So if you were to do the heel, again, you can see there, you've got the back of the heel and you can pop the sample in there. And that's because it's going through a bit thicker and it doesn't hurt as much going through the heel. So some considerations then around, obviously, collection of capillary samples. And that's obviously to make sure that the site's clean. If the site's cold, it's quite hard to get a sample. So, and can also give false reads on the hemoglobin counts and the cell count. So if you're using the sample for a blood read, so we're looking at maybe blood counting for haemophiliacs, people with low iron deficiencies, etc. If the hand's cold, what you tend to get is the surface blood rather than the actual oxygenated, nice flowing blood. So it's really important that whenever you take a sample, you're going to warm up the site. And it's quite important to know that because equally, from a venipuncture point, when we do venipunctures and we're taking blood samples, if the arm is cold, we would normally warm it up as well. So, you know, pop a jumper on, wrap a towel around it, just try and heat the site. And equally, site should be massaged until it's warm. So whenever I do a finger sample, I always go to the side of the finger. I normally warm it up first and I normally squeeze it and put a little tourniquet on my finger, because as you can see, if I do that, it goes nice and bright red, which basically means it's filled up with nice warm blood. If I let go, it disappears, capillary refill. And then if I squeeze at the bottom, massage and squeeze up, I'm just squeezing the blood to the tip of the finger. So when I stab it, it doesn't hurt because the natural tourniquet that I've applied around the finger kind of cuts some of the circulation off and doesn't make it hurt as much. So materials required for capillary blood sampling. I think the bandage is slightly over the top. Cotton causal pads, alcohol wipes, and then your lance. So single-use disposable lances. And you can see in the picture there, you've got the injected lances, the lances that are on the spring. So they're spring loaded, they click in once and then they're done and they give the prick. Normally when I do them, I've got the old fashioned sticks, one dab. Obviously the spring loaded ones are a lot quicker, so it doesn't hurt as much for the patient. So the technique then, rub the site with the cotton or gauze pads, use an alcohol wipe to clean, remove any dirt or loose skin, and obviously increase the blood circulation to the area. If the heel is to be punctured, then this first should be warmed, immerse it in water, clean it with a hot towel compress, and obviously you should be able to obtain that. After the skin is dry, make the puncture 2 to 3 millimeters deep with a sterilized lance. A rapid and firm puncture should be made. So if you are just using the blue sticks, the blue lances that you take the top off and you just dab, one quick dab, or the spring loaded. And the puncture shouldn't be painful because it's superficial. And if you need to repeat as necessary, you can. And obviously we just squeeze till we get the blood coming out. The first drop of blood which contains tissue juice should be wiped away. So again, never take the first bit of blood that comes out because it can contain the skin cells in it. So wipe the first bit of blood away and then keep squeezing. The shoulder shouldn't be squeezed too hard or pressed to get the blood because of the tissue. Allow it to freely flow and then apply moderate pressure. Stop the blood from flowing, that's not a real word, is it? Flowing by applying pressure to the site using the gauze pads or cotton balls. Cotton balls are not recommended because obviously they stick to the site if it continues bleeding. It doesn't normally when I've done it, but anyway. Advantages of capillary blood. Obviously, it's easy to tame and the preferred specimen for making different types of results and the anticoagulants, so can affect the cells. So with the capillary one, because it's surface, there's other problems around, it's less dangerous. So if we go intramuscular, so if we're going to take a needle sample, the problem that we have with those is if we miss the needle, if the needle goes through the vein, we can cause them to bleed. If they are known to be a haemophiliac, then, and it's really difficult for them to bleed, any intramuscular, any deep tissue gathering samples can cause further problems. So capillary collection is actually a really easy way of getting blood samples if you needed to get a blood sample. Disadvantages, obviously you only get a small amount, so it could take quite a few times to get that blood sample. I have seen people, or I've seen phlebotomists puncture 2 or 3 times to get more out of a finger if they're trying to get a decent blood sample. Obviously, the platelets count can't be performed on a capillary, so if they're doing a blood platelet count, so normally for patients with HIV, where it's really important to get the platelet counts and the white cell counts, obviously it's not so good there. The position is, the precision is poorer in a capillary than venous, because obviously the problem with venous, the problem with capillary blood samples is it's not as well oxygenated, because obviously it's not in the arterial line, it's gone surface, it's more need deoxygenated going back. So again, you may not get the right read that you actually need. And obviously it can have some results with the phlebotomy, with the results, sorry. So the collection of blood from the veins, the venipuncture, also refers to phlebotomy, necessary for testing most things. Larger quantities of blood, plasma and serum can be collected. So venipuncture and blood collection via those sites is a lot easier. The site for puncture for venous is normally in the forearms that are preferred. Wrists or ankles can also be used. The veins is the one, so if you're looking in your arm, so where we're going to go there, if you all rub in between here, you'll feel your vein there, and that's the vein in which we're going to do blood collection from. So if you struggle to get your vein up, if you just squeeze your arm underneath at the brachial point, if you squeeze there and pump, you'll see your vein pop up, and just gently touch, and you should feel it wobbling. Yeah, can you feel your vein there? Yeah, so if you can't, it's fine, it just means you need to put a tourniquet on to tighten it up to get the vein up. But that's the easiest one, and when I teach you blood taking, venipuncture, that's the one that we're going to teach you to use, because it's the easiest one, and all of the other veins do require specialist training and a lot more, where this one actually, it's a nice easy site. and it's easy to get. Obviously, the problem with the wrists or the ankles, wherever we're going to go, if you're a larger person, especially down here, we can end up with rolls of fat here. So it makes it really hard to get the veins. And equally on the tops, some of us have some great vein lines which we could probably extract from, and some of us not so great. So it's obviously easier for a man because our veins are a lot, they're a lot more surface and easier because we're pumped up with real men. Where ladies' hands, that's not true. Where ladies' hands, obviously, it's quite hard to see some of those veins. So it is a bit easier to take blood from men than women. Look, you can see here. So here, the veins on the forearms, the ones in which we're going to use is the medium vein. So it's the strong one that comes down the arterial line and in. And actually, the medial vein, it's the one that you can feel. It's nice and easy to find. And to be fair, if your arm was pumped up like that, you have over pumped that arm. We don't need veins that big to see. The reality is when we're doing any blood taking or capillary taking, we don't need to be raising veins like that. We should be doing it by feel. And I have seen some people do some terrible jobs. But the reality is what we need to be doing is obviously just find the most suitable site for taking that. And the arterial surface on the left arm showing the veins more suitable for venipunctures. So the left arm, based on the fact that that's where, if we look at the heart, the aorta side is a lot stronger on the left arm. So actually the left arm's easier to take blood from. But the reality is we can take blood from wherever we need to. It is just, can we find a nice vein to go in? What we have to think about when we're taking bloods is the direction of the vein and the way that the blood's flowing. So for example, we can see here that the blood will be traveling down the vein, it's going down, and then it goes back up to be deoxygenated. So oxygen comes down, deoxygenated goes back. When we take blood, we need to take from the direction of travel. So the needle and the positioning is the direction of travel if we're going to take a blood sample from the arm, so the venipuncture. So as we go into that arm, we would be going kind of that way in, because we want to go towards the arterial line up to where the blood's flowing. So when the needle's hit, the blood's flowing down through the needle, not the other way around. It'll make sense when you do it, but it does have to have a little bit of knowledge beforehand. Venous blood collection in infants and children. Obviously, the problem that we have with children and infants is their veins are a lot smaller. It's a lot trickier. The size of the needles are a lot thinner. Adults tend to be reasonably good. They tend to stay still. Children tend to squirm a bit. So actually, with positioning for your needle, you need to be quite quick and quite concise. And it does require a lot more experience taking it from children, basically because the interpersonal skill bits. Adults, however, are normally quite good unless they have dementia. Normally, if you're trying to take blood from somebody with dementia, be mindful of the other arm coming to hit you. So again, it's something that I would be doing as a two-person because they may not understand what you're doing, and it's going to take probably a little bit more skill to do something with dementia because they may be wriggling around. Equally, what other conditions in older people can make it hard? So if you're asking someone to stay nice and still to take a blood sample, what can make it really difficult? What are health conditions?
Anxiety as well, if they're frightened, I think.
So if they're frightened, yes. So if you have got somebody with fear and phobia, that's difficult because what you want is the arm to be nice and relaxed. And if somebody's tense, you're going to be causing muscle damage with that needle. Where if you're nice and relaxed, the needle just glides. If you're tensed, it can be quite difficult. So we don't want to be popping things into tense people. So Think of medical conditions. What medical conditions can make it really hard?
When I don't know, when people are always
Parkinson's disease, yeah. So if they've got tremors and Parkinson's disease, that's going to be tricky. The other one that's really difficult is if they've had a stroke and their arms are locked. So again, trying to relax those muscles. So you may need to think about medication. So for Parkinson's, have they had their Parkinson's medication? Because at certain trigger points of the day, they're less shaky than others. So it may be an activity you have to time. With somebody who's had a stroke, you may be thinking things like, have they had the diclofenac? Have you tried to do muscle stuff to help them more relaxed, to be calm? So again, you want to avoid any jerking movements, especially because you're new to taking bloods. If somebody is shaking, you're probably not the right person to do it. Okay. Oh, we might as well do it. We're here. So venous blood collection then. For the venous blood collection, you're going to need your gloves, your venipuncture tubes, your needles, syringes, tourniquets, cotton wool, wipes, pads, sharps, container. This isn't an aseptic technique, so you don't have to be sterile to do this. However, you do need to be clean. So your surfaces you're going to wipe down, you're going to obviously decontaminate everything, and the things that you're going to use, you're obviously going to make sure they're clean. So here you've got your vacuum tubes and you've got your barrel. Okay, so vacuum tubes you can see come in all different shapes and sizes. Different colours will result in different blood results. Okay, and on your cards, you'll be pleased to know there's a set of what each of those mean. So when you buy these and the doctor says, can you do a hemoglobin count or can you do this one? You'll go, oh, I need the yellow one. Okay, they don't necessarily tell you which colours, they just tell you we're going to do a thyroid count or we're going to do a hemoglobin count or we're going to do a white cell count. So you have to know which colours to select. Now, the important thing with a vacuum tube is this. It is a vacuum. It is airtight. So if you pierce that vacuum, the vacuum's then dead. You get one shot with a vacuum tube. Okay, so if you connect it and it doesn't draw blood, then you're going to need to get a new tube. Okay, so vacuums work once. Once it's pierced, it needs to be connected for it to suck the blood into it. If you connect it and it doesn't suck, bin it, do another one. And these barrels, obviously they're single use only. We know that because they've got the plastic and the two, the circle and the two, and they should only be used once. And you will see that on the venipuncture videos, you'll see all of that. And when I come out, we'll bring the arm. You will all be taking my blood, by the way. So by the time we, my students, oh no. Yeah, which means if you bruise me, you fail. So when we do this, I've taught this now probably quite a lot. I've never been bruised by any of my students and they've all managed to do it. So far, I'm at 100% pass rate on this. The reality is I'll bring the arm, you'll have lots of practice, then you'll do it on a real person. And what you'll find is it's easier to do it on a real person than what it is the arm. So if you can draw blood on the fake arm, you can draw blood on me. It's no problems. So what we're going to do, the first thing we're going to think about is our needle. Okay, so the needle, we need to be thinking about the size of the needle. Is it a safety needle with a single use? So these are the safety needles single use. So they've got the clip points where you can just push it down and it snaps it shut. So it avoids needle stick injuries. Obviously color coded for different size gauges. And when we're talking about size gauges, we're talking about the bevel at the end. Now, when we talk about the bevel, this is really important. The bevel is the end of the needle. Okay, that's called the bevel. And when it goes in, you can see the bevel should be upright because it's got that little sharp bit on the end. And that little sharp bit pierces the skin and allows the needle to glide into the arterial line. If you have it the other way round, it doesn't glide and it can pierce and it can be quite painful. Okay, so whenever you use a needle, you need to make sure it's bevel up, so the right way up, as it is in that picture. So normally, I'm sure you've all had bloods done where you've been bruised over your years. Has anyone had their bloods done when they get a bruise afterwards? It looks like you've been butchered. No, just
I think I had one when.
yeah. So when you get a bruise, yeah. So when you get a bruise, basically either they've gone bevel wrong way up, so they've punctured the skin and caused it to bleed, or they've gone through the vein, through the artery, and then through the artery again. So they've gone straight through the artery, both sides. So that's your artery, and they've gone like that. They've gone straight through. Because what we should do when we put the needle in, we're trying to glide the vein. We're not trying to pierce it two sides. We want to go in once, and we want to glide it. Okay. What you tend to find is if it goes all the way through, then that's what causes the bleed, because it's now bleeding both sides, and that's not what we wanted. It's just done through carelessness. It's just done through absolute carelessness. People that just are doing the job, task orientated, they forget that they're piercing a human, and they bruise you. So what we have here, the functions of the needle. Okay, so as we pull the needle out, you've got your needle end, so that's the metal bit. We've got the shaft. Okay, so that's the bit in the middle with the cylinder and the range. We've got the hub, which is further down. And here you can see you've almost got on the opposite end, you've got that plasticky bit of the needle. And that plasticky bit, the shaft end, is the bit that goes into the test tube. Okay, so that's the plastic bit. So the needle goes in the arm, the other goes into the barrel, into the test tube. Okay, so one into there, one into there. Again, different needle sizes, different gauges. So again, you would generally be told what ones to do. I normally, well, the ones that I teach you on is the black and green, because they're a lot bigger and easier to use. So, but again, you've got different ones for different people. Children, obviously 23 gauge, but you won't be doing children anyway. So you would only have the equipment that you need in your service. So what we're going to do, when we put the needle into the barrel, it kind of twists in. So it pushes in and it twists onto the barrel. Okay, so the barrel is that plastic bit that I just showed you earlier. And all you're going to do, you push the needle into the barrel and you twistle it on. So now what you've got is a needle and a barrel together. Okay, and you're just going to clip those on together and they screw in to one motion hold. The safety of the needle, obviously, you've got your safety clip there, so that's fine. And with needle safety, obviously, if you do injure yourself, you must follow your needle stick policies and procedures. So generally, if you do prick yourself with that needle, you're going to go to a sink, you're going to bleed yourself, hold your arm down, bleed it out, and then get yourself to an A&E department and obviously explain what you were doing and why you were doing it. It's rare to get a needle stick injury. The only time people get needle stick injuries is when they stop thinking about what they're doing and they go to pick it up the wrong end. Okay, so shouldn't happen. Tourniquets. So tourniquets are used to slow down the venous flow that's affecting the arterial flow. So we're just going to tie that up. Normally, when we put a tourniquet on, it's 4 fingers, so it's 10 centimeters from the arterial line. So if we're going to take blood from here, because that's where our artery is, we're going to go 4 fingers, so about 10 centimeters above, and we apply the tourniquet. And we do that just to bring up the vein so we know where we're going to put the needle. So we get to see the site that we're going to inject. Tourniquet shouldn't be left on for more than 1 minute. So this is quite a quick procedure. Once you're in, you're going to release the tourniquet. So once you have tourniqueted somebody, you're happy with the site, you can either take the tourniquet off or you put your needle in and then take the tourniquet off. So it depends on your dexterity skills, how good you are with your hands, because obviously once that needle is in somebody's arm, you don't want to be faffing around. You don't want to be pulling it in or out. You don't want to be shaking it because they're not going to thank you. So you're going to pop the needle in the arm. You can either remove the tourniquet, and then that will allow the blood to flow into the venipuncture, into the test tube, but obviously no more than 1 minute. Obviously, gloves, you can use normal gloves for this. Like I said, it's not an aseptic thing. They just need to be the right type. And make sure your gloves fit for needlework. So if you are taking blood, do not wear gloves that are too big. You do not want flappy bits of plastic at the end, because you have to get, those gloves need to be tight on you, because you have to feel that vein and you have to make sure that you're getting the right side. So technique for venipuncture then, relatively straightforward. You're going to assemble your equipment. And what I tend to do is I would get all my equipment first, pop it in a tray. I'm going to prepare my needle, put the barrel on the end, screw that up, ready to go. And then I'm going to mark out where I need to put it on the, find the artery, find the site. And then I start to hold everything in my hands. So what I would do, in one hand, I've got my test tube, I've got my gauze, and I've got my tape on my glove. And in the other hand, I've got my needle. So as I put my needle in, nice and straight, I can then take the test tube out, pop it on, and then when I take that out, I've got the cotton wool in and I can apply it. Because you're going to be working with one hand. When that needle's in, it's going to be one hand. Obviously, the needle to the barrel, so you can see there, it's just to show you the right way of doing it. This is your bevel at the top in position 1. Can you see my mouse when I move it around the screen, by the way? You can. Oh, right, okay. I didn't know whether you could. Okay, so here in position 1, you've got your bevel. That's your barrel going around the side. That's your test tube. It's really important that when you clip that test tube in, it fully clicks. Now, what tends to happen is once you've got the needle in the arm, you've got to push the test tube into the barrel. And what can happen is you glide, then the needle goes in deeper because you're pushing. So make sure you're holding the needle so it doesn't glide in, because you're going to go too deep. Okay, but if it's not connected, it's not going to work. And obviously, if you can't get blood out, then you've got to go back and think about your position, or have you got the right site at all, or are you in the right vein or whatever. But we'll talk about that in a sec. The point of the needle obviously goes in without puncturing if you lose the vacuum on the tube. So obviously if the vacuum of the tube goes, that's no good. And then finally, you now start your normal bits. So identify the right patients, make sure that they're sitting comfortably, identify yourself, be friendly, state your name, state why you're going to do it. Obviously, explain what the specimen is, why you're going to collect it, what are you hoping to get out of it, and get them to say their full name. So it's just no different to medication checks. So you're going to do the same bits all around this. Client identification, so spell their name. So on the test tubes, you're going to write who's this for. So make sure you write on the test tube before you use it, and make sure that you've done your ID checks, etc. Obviously, and if you're going into a patient's room, knock on the door, greet them, or if you're in a ward, obviously do your bits there. State your name, state what you're doing. If the patient's asleep, wake them gently, speak softly, never turn on the light. So this is all just your bedside stuff. Unconscious patients, so identify yourself in front of the patient, ask the caregivers to identify the patient, compare the information to the identity bracelet, continue to speak to the patient. So even if the patient can't talk to you, we would talk to the patient as if they were in the room with us, because we don't actually know that they can't hear. So if we are going to take a blood sample, we would still talk to them. So if the blood work is needed immediately, excuse yourself and explain why you need to do it. So once you've taken the blood sample, normally you've got up to 2 hours to get it where it needs to be. So once you've collected those bloods, they normally go into a fridge, then they're collected, or if they're going to be held at room temperature. So again, different blood samples, so the different collections could result in different ways of storing them. So just make sure if you are going to take blood, you know which way to store them. Reassure the patient and then untie the tourniquet, prepare the arm. So we're going to swab the arm for the needle site, leave that for about 30 seconds to dry. Position the tourniquet, as we already said, between 7.5 and 10 centimeters from the venipuncture site. Put left side over the right side and mark an X. So this is how to tie the tourniquet. Now, all you do when you put the tourniquet on, you just tie it up. So, you know, like you're just doing a normal bow, like the first tie. So you do your first tie, you then take one end and just tuck it back under. And then all it means is when you pull that end, it comes off in one go. It will make sense when you do it practically. But what you must realize with the tourniquet, you must be able to take it off with one hand, because one hand's going to have the needle. So if you don't practice your tourniquet tying, it's going to be a problem because you won't be able to take it off correctly. Well, you can see that there. So here, you've got your loop, and basically that bit at the bottom, if I pulled that now, it would come off. Yeah, so that makes sense. You'll see it on the videos. There are practical videos for you to have a watch. But the idea is it's easy to remove, one hand. Now, the old clippy tourniquets that you used to get, the material ones, we don't use those anymore because of infection control. Or alternatively, you may see other tourniquets that are pink and they've got like a button and it clips over the button. So you can either use those or the blue strips. It doesn't matter, but they're single-use ones. Clean the arm with alcohol wipe 70%. Clean the area in circles. Do not retouch. Let air dry. Grasp the back of the patient's arm and the elbow. Anchor it down. Select the vein that you're going to draw. Use the skin tightly over the vein so you can clearly see the vein. Insert the needle promptly into the vein. The index finger is placed alongside the thumb, so as you're going in, and the bevel facing up. So with the barrels, the good news is you can't go that deep. So my concern when I first did this was, what if I go all the way through? The barrel, the big plastic bit on the end, does stop you going too deep in. Okay, so the trick is, when you put the needle in and you've got your vein, hold it at a 45-degree angle. So you're kind of going in at that angle, okay? Because you don't want to be going down because you'll go straight through the vein. You don't want to be going too deep because, again, you'll just pass that vein. So 45-degree angle, when you put the needle in, nice 45-degree angle, and then it'll just glide along the vein line, the arterial lines. You kind of want to go in and do that. And then actually you can't get it wrong. When the needle is in the vein, then get your vacuum tube, push it on, and then the vacuum should just start to work. What you might see is a little bit of blood coming out. What you then do is release the tourniquet and the blood should flow. Because if you think about it, the tourniquet is stopping the blood flowing. So when people find it difficult to get collections, I did a training video with one of my other students and she left the tourniquet on, but I still videoed it just to show the difference. So you will still get a blood sample. It just takes a bit longer. Okay, so it does happen. It just, you might not get as much. So take the tourniquet off. After drawing the required amount of blood, you're just going to pull the needle out, pop the cotton wool on, and then just tape it up. Instruct the patient to press down. They normally hold it for about 5 seconds. You're going to invert the tube 8 to 10 times. So if there's anything in the test tube, you're going to mix it. You're going to make sure it's labelled correctly. You'll re-inspect the venipuncture site to make sure the bleeding's stopped. And again, that you haven't done any real bruising or damage. And obviously, if it hasn't stopped, you're going to keep the patient there with you until it stops bleeding. Inverting and mix the tubes. So when we talk about inverting, we're going up, down, up, down. So we're not shaking, we're actually going up, down, up, down. That's what inversion means. And then obviously, sometimes what you have in the bottom of the tube, there's a gel. So it mixes the gel with the blood. That's all we're doing now. So, as you can see then, they've got the tourniquet on, the bevel's going in, the tube's there, and can you see, just in picture 1, her index finger is under the tube. So it's under the barrel. By doing that, you keep it at that 45-degree angle, so that finger shouldn't move from that side. So once you've inserted the needle and your finger's under the barrel, you are at that perfect 45-degree angle. Yeah? Don't know why there's blood in this picture, because you won't see blood at that point, because if you have seen blood, you've either gone too deep or gone in twice. Once you're holding it there, you've only got one hand. So in the other hand, you now connect the tube and then you can remove that tourniquet. We certainly don't use Velcro tourniquets because that would actually pull as you try and pull it off. It wouldn't work. So the bevel's in, hold it nice 45-degree angles, pop your test tube on. It will naturally fill up with blood if you've got the right vein, and then you're good to go. Okay, so these are different types of what they're used for. We're not going to worry about that because we don't do that. Tube stoppers. Don't need to open that. Okay, and then these are the manual ones. You won't be doing manual techniques. Okay, so if you do venipuncture, you'll only do vacuum, but obviously you can manually draw in. So it's the same technique. You would have your needle connected to the syringe and you just draw back, but you would need further training on those ones, so you can't do that. So we're not going to worry about that. We're not going to worry about that. We've covered bits of another. I think this is covering the same thing. Yeah. Right. Okay. So needle in the position, just so we're aware of what we're trying to do there. So if the needle doesn't go in deep enough, it's not going to pierce the arterial line. So you can see that in picture 1. So you do need to go in a little bit deeper, but equally, you've got to make sure that the position of the needle goes in enough so the bevel has pierced the arterial line. Yeah. But can you see the barrel is pretty much, the end of the barrel is touching the skin. So as that goes in, the barrel's going to stop you going in any further anyway. What you tend to find is if you don't get any blood at that point, just wiggling it, just gently, would pierce the vein if you haven't pierced the arterial line or the vein at that point. So it is about the case of going it. So you can see the correct angle is that nice 45 degrees, and you obviously don't want to go too deep, because if you go too deep, you're going to go in and out the other side, and then that's going to be a real nightmare. The needle has slipped. So once you're in and you're going to put your anchor on, your anchor is going to be that finger underneath that stops it sliding back and forward that we showed you earlier. And the needle position cannot be determined. So you need to try and feel the vein, make sure you get the right site. And if you can feel the vein, again, you can try to redirect it. If you can't get that at that point, we would come out and choose a different arm. So you get 2 attempts in taking bloods. You've got your left arm and then your right arm. If you haven't got it after the second attempt, abandon. Okay. Why might you find it difficult? What might be the problems that you can't get a vein up? No?
Skin is so thin.
Yeah, so it could be to do with the aging process. So maybe it's difficult to find. Maybe there's too much fat around it or something like that. You've got other cardiac problems. So those that have had strokes and things, it could be a little bit more difficult. So there are certain reasons why you might find it a bit more difficult. So don't worry if you do. Obviously, if you can't find the vein, don't probe around because obviously it'll hurt them. So don't go in and out with a needle. Once the needle's in, if you've glided it in and you've put the tube on, the test tube to get the blood, if it hasn't flown, take it out, abandon it, choose the other arm. Okay. And then therefore, again, for a false mission, only attempt it twice. The vein might collapse. So if you've got a collapsed vein, it means the blood's not flowing through it properly. So if you've got a collapsed vein, it can cause it to be a bit more problematic. Think about the tourniquet. So you might want to remove that and have a look at that. And if it still doesn't feel like the vein's there, remove the needle and begin again. Okay, so if the vein is quite deep or it's quite difficult. Oh, yeah. The hematomas, so this is what tends to happen is if somebody's a bleeder as well, they could just start to bleed out. So the vein starts to bleed under the skin starts to swell up and it looks bruised and everything like that. And again, they might start leaking around the puncture site. So if you put the needle in and it starts to bleed outside the needle, like that actual image did, that first image, you obviously would then deal with that, apply enough pressure to the venipuncture site. Other things there then obviously around obesity, so other complications. So it could be quite difficult to find the vein and damaged veins. So they could just be difficult to find, etc. Other problems then, so allergies to think about. If you're using alcohol wipes, if you're putting plaster on people, just make sure that you've thought about those. People may have seizures or they might pass out due to the fear and anxiety of the situation. So knowing that beforehand is really useful. If you know somebody has a real phobia of needles, try distraction techniques, get them to look away, play a bit of relaxing music, but then give them that time to recover. Or equally, if they do bleed a lot, excessive bleeding, you should obviously just keep that pressure on for 5 minutes. Other fainting, other conditions as well then, so if they faint, if they've got a history of that, then lie the client down. You can treat them for shock, lift the legs up, get the blood back to them. No different to our first aid principles. Bring the knees up and obviously get them to breathe. If they're feeling sick, make them feel comfortable, get them to do deep breaths. Infections, so it is a rare occurrence because actually you've cleaned the site, you're going straight in and out, but equally, if you know that people are poor healers, so who are poor healers? Which conditions make you a poor healer?
Diabetes.
Yeah, so if you're diabetic, HIV positive, with the IC counts and they're not quite right, you know, think about the infection control procedures there, making sure that the site's clean, you're applying a band-aid, etc. afterwards.
What about anemics?
Yeah, so anemics, again, for the bleeding and stuff.
Haemophiliacs.
Yeah, so if they're a bleeder or they've not got a lot of blood, it's the same problem. So just knowing that beforehand, especially if you're new to taking bloods, the more you know about it, the easier. There is little pain associated with it. So if somebody starts saying, this is hurting, it really hurts, listen to them and stop. What medical conditions can make it a lot more painful for somebody than others? So there's a couple of medical conditions that would just naturally mean it doesn't matter what your technique is, it's still going to be quite painful for them. So think about the nervous system. So anybody with a nervous system condition, so something maybe like fibromyalgia or something like that.
I was going to say fibromyalgia, something
regardless of what you do, yeah, regardless of what you do, it's still going to feel quite painful. So actually, just explain it to them beforehand. So if you know if they've got either a muscular condition, so muscular cirrhosis, MS, ME, or if they've got a nervous system, also, so if they're on pregabalin or something like that, it would probably indicate that actually it doesn't matter what you do, it's going to still be quite unpleasant for them. And obviously, just making sure the tourniquet is not on too tight. So an inverted arterial pressure, so that's obviously where you've gone straight through. So if you think you've gone straight through, you're going to hold for at least 5 minutes. The arterial blood has a bright red colour, filling the tube very quickly. So when we fill the tube, it should be nice and dark. Okay, so we're going nice, quite dark, deoxygenated blood. If we're getting fresh blood, then we've gone to the arterial bloodline, and that's not going to be, it's not going to give you the right lab results. So when you get the bloods, people used to go, oh, your blood's nice and bright, that's really healthy. That's not what we want. We want the darker blood because we want to come from the arterial line there. So we want to get it from the veins. The arterial line, obviously, it's going to be really bright and frothy and light. So if it is filling up quickly, you've probably gone straight through and you've gone too far. So you've hit the wrong line. We don't need to worry about that. Safety requirements, obviously, always understand universal blood procedures when drawing blood. So if you're going to do this in your homes, make sure that you've got them. Make sure you wear your gloves. Identify patients by asking their name. Do not allow tourniquets to remain on the arm for more than 1 minute. So once you've got in, make sure that tourniquet comes off and make sure that you've properly labelled up everything. Make sure you've done the identification and the blood collections. Wash your hands, wear gloves, clean the arm, anchor the vein, use your thumb, make sure, get the vein up and allow it to go in. So that's pretty much at that point. We will stop there for lunch. And what I'm going to do, I'm going to move a session up after today. So the videos for today's session, because I think venipuncture is slightly further down. But what I'll do is I'll move those videos up so you can watch the videos on how to take blood. The reality is when I come out to see you, like I said, you'll practice on the arm anyway, and then you'll practice on me because if you can't do it on me, then I wouldn't let you do it on anyone else. So you'll take my bloods, and then once you're done, I can sign you off for that, and you'll all be done. So shall we stop for lunch for half an hour and back for 1? Is that okay?
Thank you.